St. Luke's Children's Hospital was a place that carried a mix of hope and sadness within its walls. The hallways, illuminated by soft lights, and the constant hum of medical equipment gave the environment an air of forced serenity, where doctors, nurses, and families strived to provide as much comfort as possible to the children in treatment. The routine was heavy, but for the hospital staff, it was a daily battle for the life of each patient. Dr. Richard Miller, at 45 years old, had seen and experienced much within that hospital. As the chief physician, he spent long hours overseeing the most critical cases, doing what he could to save those little lives. However, the emotional toll of dealing with terminally ill children was beginning to show its marks. His graying hair and unkempt beard reflected the fatigue accumulated over the years, as he walked the corridors with determined steps but a heavy gaze. On that particular morning, something caught the attention of one of the nurses. Emily Carter, a 30-year-old, was accustomed to observing every detail in the hospital, always concerned about the well-being of the children. While taking care of the young patients, she noticed a dog sitting near the main entrance. It was a medium-sized mixed breed with a golden brown coat and a white patch on its chest. It had a calm posture, with deep, attentive eyes, as if it were waiting for something, but without showing any anxiety or restlessness. It was common to see stray animals roaming the area, but this dog seemed different. It did not approach anyone, nor did it let itself be intimidated by the movement around it. It just watched, calm and vigilant. Emily mentioned it to some colleagues, but most dismissed it as a coincidence. However, the dog's gaze remained fixed on the hospital door, as if it knew something that others did not. In the following days, the dog continued to appear. Always at the same time, always in the same position. Some staff members began to recognize it, referring to it as the door dog. It caused no trouble and did not try to enter the hospital. It simply waited day after day as a silent and constant presence. Dr. Miller, skeptical by nature, did not give much importance to it. To him, it was just another stray animal looking for shelter or food. However, Emily began to notice something curious. On the days when the dog was present, there seemed to be an unsettling coincidence. Whenever a terminally ill child was near death, the dog was there at the door. At first, this seemed like a mere chance occurrence, but as the pattern repeated itself, the feeling that there was something more to this silent presence began to take shape. While caring for the patients, Emily kept an eye on the dog. It did not move, nor did it make noise. It simply watched. There was something almost comforting about its presence, something that made her feel an inexplicable calm, as if the dog were there to offer some kind of solace that no one else could provide. With each passing day, Emily wondered more about that animal and the reason for its visits. But for now, all she had was a mystery. A mystery that seemed to be just beginning to reveal itself. The presence of the dog, which the staff began to call Max, became a constant at the entrance of the hospital. He showed up almost every day, especially during crucial moments. At first, the doctors and nurses paid little attention, thinking that Max was simply looking for shelter or food. But as the weeks passed, something more intriguing began to catch the attention of Emily and the other staff members. Dr. Richard Miller, although always focused on his work, started to notice the pattern. He was a pragmatic man, guided by science and logic, but he could not ignore the coincidences. Max seemed to somehow know when a child was in their final moments. At first, Richard found the idea absurd. How could a stray dog predict something like that? Still, he couldn't deny that every time a terminal child was about to pass away, the dog was there. The nurses began to comment among themselves. Some, like Emily, were intrigued. Others thought it was just a coincidence. Max remained at the door, calm and serene, never trying to enter. On the days he appeared, there was a feeling of anticipation in the air, as if something inevitable was about to happen. Emily decided to pay closer attention. On the days Max was present, she noticed he seemed especially alert, his eyes fixed on the door, as if he knew something important was happening inside. When a critically ill child was in their last hours, the presence of the dog became a certainty. It was almost as if he was waiting to offer a final comfort, even though no one knew exactly how. The medical staff began to treat the dog with a mix of respect and curiosity. Dr. Miller, still skeptical, couldn't shake the unsettling feeling that perhaps there was something inexplicable about that presence. He had devoted his life to science, but seeing Max every day, sitting calmly at the entrance, made him begin to question the certainties he had always embraced. On one of those days, a young patient named Grace, only 7 years old, was in her final moments. Grace was battling an aggressive form of cancer, and despite all medical efforts, her body was giving in. Max appeared at the door that morning, and Emily felt a chill upon seeing him, as if the dog knew that this would be one of Grace's last visits to the hospital. He settled near the entrance, watching intently as family members came in and out, saying their goodbyes to the girl. When Grace passed away, Max stood up, took one last look at the hospital, and silently walked away. Emily, who had been with the girl since the beginning of her fight, was deeply touched. Max's presence, though silent, seemed to bring a calm that nothing else could offer. She began to wonder if the dog was there for more than mere coincidence. Perhaps he was a kind of guardian, a being that understood the cycle of life in a way that humans could not. Over the following weeks, the staff began to speak more openly about Max, Emily, and some of the other nurses started to feed the dog, offering him small pieces of food, but he always maintained a respectful distance. He accepted what was given, but never got too close. His presence was almost spiritual, as if he were there solely to fulfill a purpose far greater than that of a mere stray animal. As the doubts and questions grew, Dr. Miller began to feel uncomfortable with the idea that there was something he could not explain. Science could not measure a dog's intuition, but the repetition of events and the precision with which Max appeared at critical moments were undeniable. The mystery surrounding the dog began to weigh on everyone, and the hospital, already accustomed to pain and loss, now faced a new enigma. As the weeks passed, Max's presence stopped being viewed merely as a curiosity and became an accepted, almost inevitable mystery. The dog's visits became so predictable that many in the hospital staff began to associate his appearances with the most difficult moments. Max showed up on the mornings when a terminal child was facing their last days, as if he knew what was to come. St. Luke's Hospital, accustomed to the melancholic routine of farewells, began to see Max as a comforting presence, a kind of guardian that no one had asked for, but that everyone silently accepted. Emily Carter, who had been observing the dog from the beginning, developed a deeper connection with him. Every day, before starting her shift, she would see him sitting in the same position near the hospital entrance, his eyes fixed on the door, serene and calm. There was something in Max's gaze that moved her deeply. Even without making a sound, the dog seemed to communicate a wisdom beyond human understanding. She approached him, offering bits of food, but he rarely accepted. Still, she felt that he recognized the gesture, always keeping a respectful distance. The hospital staff began to notice that Max never missed. When he was there, the doctors and nurses knew that a child was about to pass away. Dr. Richard Miller, as skeptical as he was, could no longer ignore what was right before his eyes. He had spent years of his life dealing with the death of children, trying to maintain a professional and rational perspective, but Max's presence challenged all his logic. Richard began to see him as something inexplicable, something that neither science nor medicine could measure. The days when Max did not appear were seen as a respite, days of hope and struggle. However, when the dog positioned himself at the door, everyone knew that the inevitable was about to happen. He became a kind of silent messenger, not bringing sadness but a sort of serenity, as if, in some way, he were there to ease the pain of the children, their families, and the medical staff. On one of those days, Max was present while Michael, a 9-year-old boy battling an incurable degenerative disease, was in his last hours. Michael's parents were exhausted, emotionally devastated, and the medical staff did everything possible to ensure he felt no pain. Max, once again, remained in his usual position, watching from a distance. However, that day something different happened. Emily, passing through the corridor, noticed that Max had moved a little closer to the hospital door than usual. He didn't enter, but he stood nearer, almost as if he were waiting for something. When Michael finally passed away, his parents, amidst their tears, looked outside and saw the dog sitting there in silence. For them, Max's presence was inexplicably comforting. It was as if the dog were there to say goodbye too, sharing the weight of their sorrow in a silent yet meaningful way. From that moment on, rumors about Max began to circulate among the families. Some mothers and fathers remarked to one another that the dog seemed to be more than just a stray. He was a symbol of comfort, a guide accompanying the children in their final moments. Even without fully understanding, the families began to accept his presence as something beyond the ordinary, something almost spiritual. For the hospital staff, Max became part of the routine. The doctors and nurses did not speak openly about him, but everyone knew that his presence brought a calm that words could not explain. It was as if, in some way, Max understood the cycle of life and death in a manner that no one there could comprehend. With each new visit, he reaffirmed his silent role, remaining on the margins but never indifferent. Dr. Miller, although still skeptical, began to admit to himself that perhaps there was something beyond science. He saw Max every day, and despite his initial resistance, he began to accept that the dog played an important role in the hospital. It didn't matter how or why. What mattered was the impact his presence had on everyone. St. Luke's Hospital was already a place marked by pain and loss, but now, with Max there, the atmosphere changed.
Before we continue with this exciting story, make sure you are already subscribed to the channel and leave a like on this video to always stay up to date with new content.
He brought a new layer of understanding and acceptance to what happened there daily. Max did not bring sadness, but rather a silent peace, something that no one fully understood but that everyone felt. And so, the stray dog, once ignored, became the silent guardian of the youngest souls, a guardian who observed without judgment and offered comfort where words failed. The impact of Max's presence in the hospital began to spread, not only among the medical staff, but also among the families of the children. Initially, the parents saw the dog as just another stray, but over time, they began to notice his presence during the most delicate moments. Emily Carter, increasingly connected to the dog, observed how the families reacted when they noticed the pattern of his visits. Some, like Grace's parents, commented to the staff that, strangely, the dog made them feel less alone during the most painful moment of their lives. It was Sophie's family, an 8-year-old girl with leukemia, that formed the strongest bond with Max. Sophie had been hospitalized for months, and her health had deteriorated in the past weeks. The doctors had already informed her parents that her time was running out, and they did everything they could to stay by their daughter's side every second that remained. Anna and Mark, Sophie's parents, were emotionally exhausted, struggling to accept that they would lose their daughter. The hospital, with its cold and clinical environment, offered little emotional comfort, and they felt increasingly isolated in their pain. Max began to appear at the hospital door every day since Sophie's condition worsened. He positioned himself calmly and silently, always in the same area, watching. He never forced his presence, but somehow, he seemed to be there just for those who needed him. When Sophie's parents passed by him on their way to their daughter's room, they began to notice something different. Max looked at them with an intensity they couldn't ignore, as if he were aware of the suffering they carried. At first, Anna and Mark thought it was just a coincidence, but after a few days, they felt something almost spiritual in Max's presence. Anna, in particular, began to see him as a sign, something that offered comfort where words failed. She mentioned to the nurses that, despite everything, the stray dog gave them a sense of peace. He didn't seem to be there by chance. He was there for Sophie and for all the other children who needed him. Emily, who was also following Sophie's condition, noticed that Max was especially attentive in the last few days. It was as if the dog were more present, more connected to what was happening inside the hospital. When Sophie's condition worsened significantly, Max did not move from his position. Anna began to talk to him every morning upon entering the hospital, as if, in some way, she were sharing her pain with the dog. Mark, always more skeptical, began to wonder if Max knew something they didn't. In Sophie's final days, Anna and Mark spent hours by their daughter's bedside, accompanying her in her last moments. The hospital was no longer a place of despair for them, but rather a location of acceptance and farewell. And outside, Max remained present. When Sophie finally passed away on a quiet morning, Anna looked out the window and saw the dog sitting outside, watching the hospital. She cried, but her tears were not of complete despair. There was something about that dog that made the pain seem less cruel, as if he were there to accompany them on this difficult path. From that moment on, Anna and Mark accepted Max as part of that process. They knew he was not just a simple stray animal. To them, Max was a symbol of serenity and acceptance, a silent companion who, in some way, understood more than any human could about loss. Sophie's family was not the only one to feel this way. Other families also began to notice Max's presence and discussed it with the doctors and nurses. Weeks passed, and Max continued to play his role as a guardian. He never intruded on anyone's space, but his simple presence brought comfort that even the doctors could not provide. When families faced critical moments, he was there, and although he had never entered the hospital, everyone saw him as an essential part of the journey they were facing. It was almost as if Max knew exactly when to be there and what to do, without ever needing a command or signal. In the hospital, Emily and Dr. Miller reflected on the impact the dog was having on the families. Emily saw how Max brought comfort to mothers and fathers facing the inevitable, while Dr. Miller, despite his logical perspective, began to accept that the dog played a role that none of his medical books could explain. For those about to lose what they loved most, Max offered something intangible, something that went beyond understanding. St. Luke's Hospital was particularly quiet that morning. The hallways, always bustling with muffled conversations, seemed suspended in time. It was the day everyone knew that Lucas, a 10-year-old boy, was in his final moments. Lucas was one of the most beloved children by the entire hospital staff. He had spent years there, battling a degenerative heart condition that, despite the best medical efforts, was finally bringing his fight to an end. For Dr. Richard Miller and Emily Carter, that loss would be particularly painful. Lucas was known for his vibrant energy and ability to make everyone laugh, even amid suffering. He had become a constant presence, lighting up the hospital with his courage and smile, despite the numerous surgeries and procedures he had undergone. The news that Lucas would not survive much longer was a harsh blow to the entire team. That morning, as always, Max appeared at the hospital entrance. This time, however, he was different. Emily noticed that Max was not just sitting at a distance. He moved closer to the door, as if sensing that the moment everyone feared was finally approaching. He remained there, motionless, with his gaze fixed on the entrance, as if he understood that this day was special. It was as if Max knew that Lucas, the boy who had seen him from afar so many times, was about to say goodbye. Emily, who had grown accustomed to the dog's presence during the toughest times, couldn't help but feel emotional seeing him there. There was something about Max that day that felt even deeper, as if he understood the weight of the situation. The dog didn't bark or move. He simply watched silently as the morning went on. For Emily, the mere sight of Max was a reminder that, even in the pain of farewell, there was an inexplicable comfort, something that words could not offer. Inside the hospital, Dr. Miller and his team did their best to keep Lucas comfortable. The boy's parents, Karen and David, were by his side, holding his hands, while the medical staff monitored his vital signs, trying to ensure that his final moments were as peaceful as possible. Outside, the day was calm, with a cloudy sky reflecting the atmosphere of grief and acceptance inside the hospital. Gradually, Lucas's heart rate began to slow, and Karen and David knew the moment was near. They looked at Dr. Miller, who simply nodded, indicating that everything that could be done had already been done. Karen, with tears in her eyes, looked out the window of the room and once again saw Max sitting there outside the hospital. Something about that sight brought her a strange sense of peace. Even in the most difficult moments, the dog's presence seemed to lighten the unbearable weight of loss. When Lucas finally took his last breath, the entire hospital seemed to stop. The hallways fell into absolute silence, and for a brief moment, everything quieted. Outside, Max remained still, as if he knew his vigil had come to an end. Emily, who was near the door, watched the dog as he slowly stood up, looked at the entrance one more time, and then walked away, disappearing into the morning fog. For everyone present that day, Max was not just a stray dog. He became a symbol, a kind of silent guide accompanying the souls of children in their final moments. Dr. Miller, who had been skeptical all along, finally understood the impact Max was having on everyone. Even without scientific explanation, the mere presence of the dog had brought something that no medicine could offer: peace amid pain. After Lucas's death, the hospital staff briefly gathered in the hallway, many in tears, others in deep silence. Emily, visibly shaken, reflected on how Max had been there during all the crucial moments, like a guardian no one asked for, but whom everyone needed. She knew that, in some way, the dog had become part of each child's journey, offering a comfort that transcended human understanding. Lucas's parents, though devastated by their loss, also felt the dog's presence as something special. Karen, upon leaving the hospital that morning, looked to the spot where Max always sat, and, even without seeing him anymore, felt a profound gratitude for his silent company. It was as if he had fulfilled his role, not just for Lucas, but for all who had passed through that hospital. That morning, St. Luke's didn't seem merely a place of sorrow, but also a location of acceptance and peaceful farewells. Max, the guardian who never entered but was always present, had left his mark on everyone's heart, and although no one knew exactly why he did what he did, everyone understood that his purpose was greater than anyone could imagine. The death of Lucas deeply marked everyone at St. Luke's Hospital. The medical staff, who always dealt with the fragility of life, felt a greater void in losing the boy who had spent so much time with them. However, something had changed with the constant presence of Max during the preceding weeks. The dog, who had never crossed the boundaries of the hospital, left a lasting impression on both the staff and the families who passed through. In the days following Lucas's departure, Max did not appear at the hospital door. His absence, which would have previously gone unnoticed, was now felt by all. Emily Carter, who had formed a special bond with him, experienced a strange emptiness without seeing him in the mornings. She reflected on how that simple stray dog had become part of the hospital's daily routine and how, without anyone asking, he had become a silent and comforting guardian for those facing the toughest moments. Rumors about Max began to spread among families and even among staff members. The presence of the dog in the days when children were nearing death was seen by many as a sign that he had a greater purpose. Karen and David, Lucas's parents, began to speak of Max as a four-legged angel, something inexplicable but deeply comforting. For them, the dog had offered a sense of peace at the moment they needed it most, and his presence was now part of their memories of saying goodbye to their son. Inside the hospital, Dr. Richard Miller, still rational and guided by science, could not deny the emotional impact Max had caused on everyone. Although he did not know how to explain it, he admitted to himself that the dog's presence had changed something in the hospital. Max did not cure diseases, but he had brought something that medicine alone could not offer: the acceptance of death as part of life. It was a hard lesson for everyone in the hospital, but the dog's presence had softened that reality in a way that even he, with years of experience, could not fully comprehend. The hospital staff began to share stories about Max. Emily, in particular, remembered how he seemed to understand suffering and how he always knew the right moment to appear. Young patients would often look out the window in search of his familiar figure, and even the nurses, who dealt with pain every day, felt that Max was there for them too, helping them cope with the emotional burden they carried. Although Max had not appeared in the days following Lucas's death, his absence was not interpreted as abandonment. On the contrary, everyone began to see his presence and absence as part of a cycle. He had fulfilled his role at that moment, accompanying children to the end, and now he seemed to have withdrawn, almost like a symbol that his work there was complete. Even without seeing him, the hospital staff knew that Max would continue to be present in spirit, offering the same silent comfort. Emily, in particular, felt that Max had taught her something profound. Although she had never touched him or heard a sound from his mouth, his presence had left an indelible mark on her life. The way he behaved, his ability to be present in the most crucial moments, was something she would carry with her forever. Max had become, for her, the true guardian of the hospital, not only for the children but for all who needed a reminder that life, even in its most painful moments, had a silent beauty. In the following weeks, St. Luke's Hospital returned to its routine. Children continued to fight, some recovering and others, inevitably, passing away. But the atmosphere felt a little different. There was a greater acceptance among everyone, a sense that, somehow, Max was still there, caring in his own way. When the weight of time began to bear down, doctors and nurses would remember the dog who, without ever saying a word, had offered something that no one else could give. As time went by, Dr. Miller realized that Max's presence had transformed his view of the medical practice itself. He had spent years trying to save lives, but Max had taught him that sometimes the most important thing was to help people accept their losses. He did not know if Max would return, but he knew that the dog's legacy would continue to live on in the hospital. Whenever a child was about to pass, he would remember how Max silently offered comfort that transcended the boundaries of understanding. Thus, Max, the dog who never entered the hospital but was always present, became part of the story of St. Luke's. He left memories not only in the families and children he had silently accompanied, but also in every doctor and nurse who witnessed his role as a guardian. And although his current whereabouts were unknown, everyone knew that, in some way, Max was still caring for everyone in his own way.
Thanks for watching until the end. What did you think of today's story? Leave your opinion in the comments. And don't forget to subscribe to the channel and leave a like. Until next time.